Hello, everybody. This is Gary. Today is December 19th, 2020. It is 2:38 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my Coping with Schizophrenia blog entry for today. Today, my anxiety levels are pretty high. My hallucinations, my auditory hallucinations are pretty much under control. My paranoia is pretty much under control. My depression is pretty much under control. My delusions are pretty much under control. When I woke up this morning, I was feeling kind of agitated. So I took some Klonopin and I practiced and did some morning meditation. Um, my next psychotherapy appointment with my therapist is this Wednesday on the 22nd of December, just before Christmas. My next psychiatry appointment isn't until February 3rd, I believe, but I'll have other support between now and then from my psychotherapist. And I'm starting a new group, as I mentioned in my other video, on January 4th. I'm not sure how many people will be in the group. It would be different age groups, different genders, different diagnoses, schizoaffective, schizophrenia, borderline personality disorder, bipolar disorder. The group will be centered around how to cope with stressful symptoms and stressful situations, both internally and externally, without panicking, without getting too stressed out, tolerating stress and difficulty better, just learning to cope with stressful situations. It's called DBT therapy or dialectic behavior therapy. It's just to help cope better with bad situations, especially if they can't be immediately changed or controlled. My purpose in going into this group is learning how to deal with stress better so I don't go to the psychiatric emergency room as often as I have been going over the past few years. The last time I went to the psychiatric emergency unit this year was on October 30th. This is about 6-7 weeks ago. So it's been a while. I've been able to be a little bit more stable over the past few weeks. I've returned to my daily schedule of work, which is I do consumer surveys online for extra money. It doesn't make me a lot of money, but it does keep me busy. The other part of my daily schedule is I meditate twice a day. I go for a walk outside for exercise. I do these YouTube videos, plus any errands like picking up prescriptions, food shopping, cleaning my apartment, doing my laundry. Sticking to the basics, by the way, is very important in mental health. And what I mean by basics is being able to keep your apartment clean, keep your clothes clean, keep up with your personal hygiene. For me, that means taking at least one shower a day, shaving, brushing my teeth, mouthwash, deodorant, clean clothes, doing my laundry, which I did yesterday. I'm lucky my apartment building has a laundry room, so I don't have to drag all my clothes on the bus to go to the laundromat. There's a laundromat right here in my apartment building. I like this apartment better than the last apartment I was in. This apartment building is designed for people who are either mentally or physically disabled or over the age of 62. It's fairly quiet here. Nobody's throwing any wild parties or anything like that. The last apartment I had was in a house, not an apartment building, and the students across the hall from me were always throwing wild parties, drinking heavily, and just making a lot of noise, which made it difficult for me to sleep, which made me go to the psychiatric emergency room even more often. I don't have that problem at this apartment. I've been here since December 3rd of last year, so just over a year. The rent's more affordable. My finances are a little bit better, so I have less stress in those areas. I have more room to breathe in this apartment. It's less claustrophobic, less anxiety provoking. For now, over the past couple of weeks, my anxiety has been a bigger problem as far as symptoms go than, say, my paranoia or my hallucinations. The hallucinations and paranoia are still certainly present. I'm tempted to stay in my apartment because of my paranoia. But I force myself to go outside and go for a walk at least once a day. Even though it's winter and it's getting colder, it's important that I stick to a daily schedule to manage my anxiety and manage my symptoms. The worst thing a person can do when they're mentally ill is spend all their time alone and not be around other people and not physical exercise. I'm on a lot of medications, some of them for medical reasons, some of them for psychiatric reasons, and I'm trying to improve my physical health by exercising more. And I quit smoking. I'm still using nicotine lozenges. I talked to my psychiatrist about how long I'll be using nicotine products to stay away from cigarettes, and we've left it open-ended. He's going to keep writing prescriptions for nicotine lozenges for as long as I feel uncomfortable in trying to quit the nicotine addiction. Me and my psychiatrist are more concerned about my actually smoking cigarettes than we are about the nicotine addiction. I have a lot of things to do, a lot of plans, and it's hard enough just not to smoke cigarettes. And this isn't really the time to try to break the nicotine addiction. So we've left it pretty open-ended that I'll be using the nicotine lozenges over the next several months, probably at least. My lungs do have some damage from smoking cigarettes for the past 30 years, and I don't want to damage my lungs any further by continuing to smoke cigarettes. And of course, nicotine lozenges, nicotine gum, nicotine patches don't cause lung damage or heart damage the same as cigarettes do, and they don't cause lung cancer. So they're safer than smoking cigarettes. Other than that, not much going on. Just trying to stick to my daily schedule, keep up my personal hygiene, keep up my exercise, and keep up with my medical appointments. Like, comment, share, subscribe.